Welcome everyone. Today, we're diving into the approach to the long case, a true test of your clinical acumen. Picture a patient with a complex medical profile, one primary issue intertwined with multiple comorbidities. This case is designed to push you to integrate detailed history, physical examination, and clinical reasoning into one coherent narrative. In a typical long case, you'll meet a patient whose medical history spans years. You're not just reviewing a list of conditions, you're uncovering a timeline of events. Imagine receiving information about a patient's initial presentation, subsequent investigations, evolving diagnoses, and complications such as hospital admissions or treatment side effects. You need to consider every aspect, from financial or social barriers that might affect treatment adherence to the overall impact on the patient and their family. This is the reality of clinical practice, and the exam is structured to simulate this real-life complexity. Let's make this concrete with an example. Consider a 50-year-old female with type 1 diabetes, diagnosed at age 15. Over the years, she has been admitted multiple times for diabetic ketoacidosis and hypoglycemia, along with episodes of pneumonia and cellulitis. Early in her disease, she struggled with adherence to her treatment regimen. As she aged, the cumulative effects of her condition led to macrovascular complications. For instance, when she presented with angina, a CT coronary angiogram revealed moderate coronary artery disease, yet without significant obstruction. Her story deepens further with progressive nephropathy. Her current eGFR is around 15, and she is now planning for dialysis or even a transplant. Adding another layer, she suffers from peripheral neuropathy affecting both her hands and feet. This is particularly impactful because she is an artist. Her impaired hand dexterity makes self-injection of insulin challenging. On a positive note, her hypertension and dyslipidemia are well controlled with medication, and her most recent HbA1c is 7% on her current insulin regimen, reflecting good engagement with the healthcare system and excellent self-care. When you approach a long case like this, start by constructing a chronological narrative. Pay close attention to when symptoms began, how they evolved, and the impact of each event on her overall health. Dissect the timeline. Note the periods when her comorbidities were active versus when they might have been dormant. Recognize that while some conditions are well managed, others, like her progressive nephropathy and peripheral neuropathy, significantly affect her quality of life and require ongoing attention. It's essential to determine the relevance of each comorbidity. Ask yourself, how does her history of DKA and hypoglycemia influence her current management? Does her past adherence issues still pose a risk? How do her chronic complications, such as moderate CAD and neuropathy, fit into the current clinical picture? You'll be expected to list these active problems in order of priority, outline necessary investigations, and propose a logical management plan, all while considering the patient's personal and social context. This case is a prime example of what you might encounter on exam day. I encourage you to practice with similar cases, ones that challenge you to integrate multiple layers of information. Work closely with your study group, discuss cases, and refine your ability to pick out the critical elements. Seek feedback from mentors and peers until you can confidently manage the complexity of such cases. Practice until the approach becomes second nature, ensuring that on exam day you can methodically dissect even the most challenging patient histories. Remember, this is more than an academic exercise. It's about understanding and managing real patients with intricate histories. Embrace the complexity, build your narrative, and let your clinical reasoning shine through. Your journey to mastering the long case starts here, and with deliberate practice and reflection, you'll be well prepared to excel in your RACP clinical exam.